Constipation, Things You Should Know, Questions and Answers, by Rumi Michael Lee. Introduction. I would like to thank and congratulate you for listening to this book, Constipation, Things You Should Know, Questions and Answers. This book will help you understand, revise, and have a good general knowledge and keywords of constipation. Chapter 1. 1. What is constipation? Constipation is less bowel movement and difficulty to pass stool. 2. Is constipation common? Yes, constipation is common. 3. Can constipation happen to healthy people? Yes, constipation can happen to healthy people. 4. Can constipation happen to both adults and children? Yes, constipation can happen to both adults and children. 5. Can constipation be chronic? Yes, constipation can be chronic. 6. What are the signs and symptoms of chronic constipation? The signs and symptoms of chronic constipation include having less than 3 stools in a week, hard stools, strain in having bowel movements, etc. 7. What are the causes of constipation? The causes of constipation include anal fissure, some types of cancer, obstruction of the bowel, rectocele, bowel stricture, stroke, Parkinson's disease, multiple sclerosis, injury of the spinal cord, autonomic neuropathy, hypothyroidism, dehydration, hyperparathyroidism, pregnancy, diabetes, dyssynergia, anismus, weak pelvic muscles, etc. 8. What types of cancer can cause constipation? Colon cancer, rectal cancer, and abdominal cancer can cause constipation. 9. What is bowel stricture? Bowel stricture is the narrowing of the colon. Chapter 2. 1. Can neurological conditions lead to constipation? Yes, neurological conditions can lead to constipation. 2. How can neurological conditions lead to constipation? Neurological conditions can lead to constipation by affecting the nerves. 3. What is a stroke? A stroke is a life-threatening condition due to a blockage of blood flow to the brain. 4. What is Parkinson's disease? Parkinson's disease is a progressive neurological disorder of the central nervous system. 5. What is multiple sclerosis? Multiple sclerosis is a chronic autoimmune disease that affects the brain and the spinal cord. 6. What is anismus? Anismus is dyssynergic defecation. 7. What is diabetes? Diabetes is a chronic disease that causes high blood sugar. 8. High blood sugar can also be called hyperglycemia. 9. What is hyperparathyroidism? Hyperparathyroidism is an overactive parathyroid gland. 10. What is hypothyroidism? Hypothyroidism is a low thyroid production. Chapter 3. 1. What are the risk factors for constipation? The risk factors for constipation include dehydration, eating disorders, little to no physical activity, a low-fiber diet, older people, some types of medications, etc. 2. What types of medications could lead to constipation? Medications that could lead to constipation include some antidepressants, opioid pain medications, sedatives, etc. 3. What are sedatives? Sedatives are depressants of the central nervous system. 4. Is constipation common during pregnancy? Yes, constipation is common during pregnancy. 5. Is being a woman also a risk factor for constipation? Yes, being a woman is also a risk factor for constipation. 6. Why is being a woman a risk factor for constipation? Being a woman is a risk factor for constipation because of changes in hormones. 7. Why is older age a risk factor for constipation? Older age is a risk factor for constipation because with age, the metabolism gets slower and there is less muscle contraction force in the digestive tract. 8. Could diverticulitis be a complication of constipation? Yes, diverticulitis could be a complication of constipation. 9. What is diverticulitis? Diverticulitis is the inflammation of diverticula. 10. Could stress incontinence be a complication of constipation? Yes, stress incontinence could be a complication of constipation. Chapter 4. 1. What is incontinence? Incontinence is the loss of the ability to control the bladder. 2. What is dehydration? Dehydration is insufficient amount of water in the body. 3. Do antacids that contain calcium lead to constipation? Yes, antacids that contain calcium can lead to constipation. 4. Do antacids that contain aluminum lead to constipation? Yes, antacids that contain aluminum can lead to constipation. 5. What are antacids? Antacids are medications that neutralizes the acidity in the stomach. 6. Can antihistamine medications lead to constipation? Yes, antihistamine medications can lead to constipation. 7. What are histamines? Histamines start allergic reaction. 8. Can certain blood pressure medications lead to constipation? Yes, certain blood pressure medications can lead to constipation. 9. Can certain psychiatric medications lead to constipation? Yes, certain psychiatric medications can lead to constipation. 10. Can certain anticonvulsant medications lead to constipation? Yes, certain anticonvulsant medications can lead to constipation. Chapter 5. 1. Can certain anti-nausea medications lead to constipation? Yes, certain anti-nausea medications can lead to constipation. 2. Can hypercalcemia lead to constipation? Yes, hypercalcemia can lead to constipation. 3. Can chronic constipation lead to complications? Yes, chronic constipation can lead to complications. 4. What are the complications of chronic constipation? The complications of chronic constipation include anal fissure, rectal prolapse, hemorrhoids, fecal impaction, etc. 5. What is anal fissure? Anal fissure is a tear around the region of the anus. 6. What are hemorrhoids? Hemorrhoids are swollen veins in the rectum and anus. 7. What is fecal impaction? Fecal impaction is accumulated hardened stool stuck in the intestines that can't be expelled. 8. Can chronic constipation be avoided? Yes, chronic constipation can be avoided. 9. How can chronic constipation be avoided? Chronic constipation can be avoided by hydrating regularly, exercising regularly, eating foods with high fiber, effectively managing stress, passing stool when the urge is need, etc. 10. What foods are rich in fiber? Foods rich in fiber include fruits, vegetables, cereal, beans, etc. Chapter 6. 1. How is constipation diagnosed? Constipation can be diagnosed through blood tests, colonoscopy, sigmoidoscopy, X-ray, MRI defecography, colonic transit study, anorectal manometry, balloon expulsion test, etc. 2. What is sigmoidoscopy? Sigmoidoscopy is a medical exam that allows the visualization of the colon and rectum. 3. How is chronic constipation treated? Chronic constipation can be treated by using laxatives, exercising the pelvic muscles, and surgery. 4. What common medication is used for the treatment of constipation? Laxative is a common medication used for the treatment of constipation. Conclusion. Thank you again for listening to this book. I hope it has helped you in your journey to understanding constipation.